Good afternoon, it's Dr. John Bennett broadcasting from Miami Beach. We have the pleasure today of having BHS Tech, who's made a very innovative technology for MicroNeurosurgery. And so we'll start right off. I'll introduce Lars, and it's all yours.
Okay, thanks, John, and thanks. We are more than happy to have the chance to present our Roboticscope on your channel Neurosurgical TV. And we have some people of my team joined. It's Robert from the States, it's Mike, it's Felix, and also Paul. And to start, welcome surgeons all over the world. I'm not completely sure in which parts of the world you're joined, but a warm welcome here from Germany and from Austria. And yeah, today we would like to show you our new Roboticscope. And in the first step, I would like to shortly give you some informations about BHS technologies. Where was the idea born? What was the intention? And then we will switch to the most interesting part to show you the Roboticscope, how it works, what are the technical parts, and what are the software behind. And then afterwards, it will be some time for questions and answering your questions. So yeah, BHS Technologies was founded by 3 guys. As it says, the company name, it's Gregor Burger, it's Markus Hütter, and Mike Santek. And it was really classical startup idea. It was born out of an evening beer in the beautiful city of Innsbruck. And the idea was founded because all 3 guys has a medtech background and a long time, and we said, okay, we need to change something. We need to make a real breakthrough into the technologies. So what can we do? And there were a plenty of ideas what to do. And at the end, it was developed a prototype which was named the Roboticscope. And yeah, we in 2000 from 2017 until 2019, at the end of the year, were on tour in Europe in their network and show the prototype and collect feedback and what to do best or do better. And yeah, in beginning of 2020, by end of March, we received our CE mark, and we have started the clinical trials and sold the first Roboticscopes in the departments of ENT. Yeah, and then after doing more and more trials under this really difficult circumstances, the Neurosurgery was getting the first place in our requests, and that's why we have we have created new channels and new ideas what to do. Yeah, and now it's we have also found in 2020 the US entity, and we have a team in EMEA, and we are growing all over the world. And yeah, now we are really happy after the weekend with John and I, Jarian, that we have the chance to present our Roboticscope. And if you want to, if you have more questions, I think we can do it in our question and answer session after the presentation of the Roboticscopes. And I will give the word to my colleague Felix, who's in our showroom in the headquarters in Innsbruck. And yeah, Felix, just start right now. Thank you.
Thank you, Lars, for the introduction. I will share my screen again. And does everybody see the 3 images now?
Not yet, not yet.
Okay, let me get it clear.
Okay. Yeah, you had it before.
Oh, there we go.
Almost. Okay, there you go.
Work?
Yes, good.
Perfect. So also hello again from my side. My colleague just joined, Natalie, the head of our marketing department.
Hi, everyone.
And it's a great pleasure for us to demonstrate to you today the Roboticscope. And we're really looking forward to your feedback and to your impressions. And yes, I would just start with a small introduction. So basically, our system consists of 4 components. We have the base in the back. You can see the black front side, which has the all the electrical parts inside. And on top of the base, there's the robotic arm mounted. Robotic arm is an arm from the industry, so we know the system is reliable. And on the top of the arm is our heart piece, you can say, the microscopic camera head. And inside there we have two cameras installed for the stereoscopic vision. And the cameras deliver the picture to the hand-mounted display, which I will explain more later. So basically, we are a fully digital system, and our main advantages are that you can work hands-free. And as you will see in a second, you are able to control the whole device just with two small head movements. One is the yes movement, and second is the no movement. That's it. You don't need more. You don't need any rotation in your upper body. You don't need to put away the instruments. You don't need to use your hands. It's only with the head-mounted display. So I will put it on my head now. We have some size adjustments there in the back. And what I see now inside these micro screens here is what you can see on the lower right image. So when I step on the foot switch, this is also really important part I forgot to say. What you do when you want to do anything with the robotic scope, when you want to move the arm, you always need to press the foot switch. This is a really important device. Normally it's on the floor. I just showed it to you. So I will step again on the foot switch. Can you see the user interface in the screen?
Yes.
Yes, now it is. There you go. So this is our easygoing user interface with two rings. We have an inner ring with the primary functions and an outer ring with the secondary functions. I will quickly go through the main functions in the inner ring. For example, on 6 o'clock, you have the free view mode. I choose a function and I go back to confirm. And then when I stay on the foot switch, I can go over the situs and orientate in the horizontal plane.
The preview is normally used for the bigger adjustments when you want to search the area where you're going to operate. And after choosing the area, then you choose another mode to go more exact or to choose like another aspect.
So what Natalie just explained, second function, for example, is the zoom function on the right side. I go back to confirm, and then we have different zoom states, and I can choose by hovering a different field. I can choose a different zoom state. What you see now, for example, is that the picture slightly got blurry because of the change in the optical conditions. So I have to focus again. Focus is also in the inner ring on the left side, and with the movement of my head, I can set the new focus plane. So basically, I'm going to zoom out a little again. These are the first three functions, and then the fourth function in the inner ring is the so-called orbit mode on the top, 12 o'clock. And when I choose this function, you will see the angle changes. And yeah, please excuse me for the model today is, I know, not the most realistic one, but I'm not a doctor. You are the doctors, and we just want to show you the basic functionality of our device. And I opened up this spine box we have for training purposes to show you the basic functions. Yeah, and then we have several other functions in the outer ring. I will just briefly go through them. For example, here you can change the light intensity when you go or any deeper cavities, for example, you need more light. Just with the up and down movement of your head, you can change the light intensity. You can change also the working distance by a few steps. Just go up to 600, go back, confirm. I have to lift the glasses to make sure the robot does not do any unforeseen movement. Also, you can, in the imaging mode, you can switch between the left view only and the right view only. Then one camera gets deactivated and you see a 2D image on both eyepieces. Exactly, we'll change back to 3D mode. And then on 12 o'clock, we have the lifting function for the oculars. We have also the function to store a position. When you, for example, want to store that position, you do like this. And then later on the surgery, you could go back to the first position. I won't confirm now because it's basically the same position. And then we also have a media tool where you can take photos or videos. Also, just by a quick confirmation, you will see the picture-in-picture, and this is how you take a snapshot, for example, or you can start a video and it runs in the background. When you want to stop it, you go like this and then it stops.
Yeah, that's very, very useful for the training reasons, for example, where you want to show later one part of the operation or one part of the procedure, for example.
Exactly, and yeah, this is basically how it works. And for example, if I step towards the table now, of course, we have the sterile cover for the robotic arm, and we also have sterile cups for our eyepieces. So we make sure that everything stays sterile. And then I could step towards the patient, press the foot switch, then I'm in the menu again. I look out for my point of interest. When I go off the foot switch, the picture freezes and the robotic arm does not move. Then, for example, I could say, okay, I want to take a closer look to the dura. I zoom in. Now I see the bones pretty sharp, but I want to see the background more sharp. Then I set the focus again. I go off this foot switch, and I can go back to my ergonomic position. And now I could do some preparations in the deeper cavity, for example. And if I want to say, okay, I want to take a look here behind the bone, we could use orbit mode and look a little bit to the side. And then what you can see is that you can take a look like around the corner. Yeah. So basically, these are all main functions, and I'm pretty excited which questions you have for us. So, are there any questions already?
Okay, anybody in the panel would like to ask a question? Don't be afraid. You guys know how it is. Sometimes it's hard to get people to ask the questions.
So maybe I can share some latest experiences in the OR and also from the field. Like what we do is, my job is a clinical application manager. So I'm there for the implantation and the surgery, during the surgery, to stand beside the surgeon and to make sure that everything works properly, also do the training in advance, as we already discussed. And yeah, we were very happy to be here on Neurosurgery TV, because we started more focused on the ENT department, but then we found out, hey, our device is pretty well shaped for neurosurgery. So we made the first contacts, I think in Regensburg, and also in Milano. There's Professor Martini, one of the first neurosurgeons who adopted our system and said, hey, I want to try this. I want to be part of the future of microsurgery. And so far we had several procedures completed. but we are of course already always in a change, and we want to go further, and we want to take a look at the different procedures and see where we can help the surgeon the most.
You know, excuse me, you mentioned ENT. You've made, you initially penetrated that niche. And is that the first niche you penetrated, the first one you had?
Sorry?
Was that the first specialty that you reached, was ENT?
Yes.
Yeah,
That's
correct, John. Yeah.
And right now, and neurosurgery was shortly thereafter?
Yeah, we are actually at the moment going for basically for 3 different disciplines: plastic surgery, neurosurgery, and ENT. And those are the best or the best areas for us to work at the moment. We have also developed, like now we developed the dual view function, which is also a good function for neurosurgical operations, where sometimes you have to have it operate together. We need an assistant, and that's why we all the time do developments to the direction of these disciplines that we have chosen. So we have also chosen special features for ENT and some for neuro, and then also for plastic. Yeah.
Okay, I know, Natalie, you work in marketing, but does a team have to really, do you guys go into the operating room and kind of watch some neurosurgery?
Yes, we do. Yeah.
You do, they kind of learn, because I myself am the same, I'm not, don't know too much about neurosurgery, but I imagine for you guys, it might be advantageous, obviously, to know what's going on.
Yeah, that's basically how the whole development process started. So we actually involved really strongly few doctors from different disciplines to take part in the development process, to get the view from them, like what they need, what are the functions that they really need in their job, what things to change their work, or how could they have an easier work place, and how to, I don't know how to explain it, but how to have it more easy in the operation. Like what are the things that are most disturbing in the operation, like leaving the operational tools on the table and then adjusting the microscope. That was the first thing where we catched. And then all the time in the development process, we are all the time thinking about the end users actually. So that's
Thank you.
really important part. Yeah.
John, I think we have questions in the chat. Can you just see?
Sure, go ahead.
Yeah. Okay, I think there's a question. Okay, how much will system have assistance ocular on the hand, on the head? This was the first question, I think, from, I hope I spell it right, Dimitri, is it correct?
Yes.
Or Dimitro? Yeah, okay. So
I don't understand the question, to be honest.
Yeah.
How much does a system ocular on the head?
Yeah. Can you maybe unmute Dimitro, and we can talk together, because the question is not at least clear to me. The second one, yes, but the first one is not so really clear.
Sorry.
Yeah, no problem.
Thank you very much for a great presentation. I think that it is amazing system.
Thank you.
Good evening to everyone. My question is about your ocular system, ocular part on your hand. How much people can use it, your Roboticscope, at the same time? How much surgeons and assistants can use this system? It's my question. Thank you.
Okay, yeah. So we have the possibility that the system can be used by 2 surgeons. One is the master, who can control the movements and the views, and the other one has the same view what a master surgeon sees. So two surgeons can use it at the same time.
Like a standard microscopic technique, for surgeon and for assistant,
Yeah, correct. But with the ergonomic yeah, with the ergonomic and the hands-free. So that's the main advantage of our system.
But maybe you mean about or consider about for a lot quantity of people, yeah, maybe for more surgeons or for operation nurse.
Yeah, this is handled. Maybe Felix or Natalie, you can switch a little bit the little screen from our robotic scope. You have a screen on the robotic scope. Dimitro, here.
Dima.
Yeah. So the nurses can watch and also others can watch, and we are able to make signals like HDMI or VGA on bigger screens, so everybody in the theater can watch the surgery.
For all operation team, yeah.
Yeah, all operation team, correct.
Thank you so much.
Yeah, you're welcome. Thank you.
Okay, more questions, comments at this point? Okay, you want to move on, Lars?
Yeah, yeah. What we can also give you, we are open for any hospital trial or for any show truck trial we can give to you with the system. Oh, I think there's coming a question. Sorry, I just interrupt.
Yeah. Well, I have a question. Just so let me ask this. We talked about learning curve before the show. How long would it take, like a neurosurgeon that's not really digitally smart as far as wearing headsets and etc.? Are they encouraged to go to your headquarters for a month or two, or for some time period before they're unleashed on the public?
That's a good question, John. Thank you. And I think Felix can answer it really well because he has developed with Paul together the training concept for the robotic scope.
Exactly. So as I told you earlier, we have a pretty steep learning curve, and what we see in our daily business is that people get the HMD on their head, and then they pretty quickly can work with the function because it's intuitive. It's an intuitive system. Like the movement of the head is pretty fast and quick to learn. But we also developed just 2 weeks ago at the Neurosurgery department of Innsbruck. We did like development of a small test I can show you. This is for a needle. So what you do is you pull the needle with your instruments through the different needle heads, and you get to know more with the functionality of, for example, the orbit mode or the free view mode. It's pretty fast. So after about 50 minutes, depends on your, as you also said, depends on your pre-educational knowledge to robotics and to handling of such devices. But we can make sure that after 50 minutes, 30 minutes of training, you're already ready to go, and you can hit the operating room together with us. That's what we always make sure that for the first surgeries, you are decided by one of our employees from the clinical application department. Also, we have several clinical application managers in the States who are also with us tonight. So we are just learning day by day, and we are learning with every surgery we see and we do how to get the knowledge from our headquarters here in Innsbruck out to the world, and how to just make the adoption of the robotic scope easier.
That's very good. We have 30 panelists, so there is interest in our community. We have a comment. Oh, excuse me, Chris Murphy, do you have a question? Chris, your hand's up.
You know, I put in the chat, I was just asking Felix to talk a little bit when he was looking at the model, to talk a little bit about the 3D versus the deep cavity mode or 2D. I didn't know if you touched on that or not. That's what I was commenting.
Really quickly, actually, yeah, sure.
Yeah, I can demonstrate again for you.
And then we have 3 additional questions from Radim. I will answer in a few seconds after Felix has presented the.
Yeah.
Okay.
So
Thank you.
what I wanted to point out that basically we are a fully digital 3D Roboticscope, but when you go into a deeper cavity, and what you normally do is you look for the focus point, and you might at one point close one eye to make sure that you have the right spot in the cavity, in the focus. So we can, with our user interface, we can switch. We can turn off one of the cameras inside the camera head on this function here, so-called imaging mode. And now you see the preview. For example, I can choose the left camera only, and now I have a 2D image. You won't see it on the screen too much, the difference, but inside the HMD, you have only a 2D image now, and it's easier to work in deep cavities. And if I want to switch to the right side, you will see a slight change of the angle. It's due to the fact that we have angle of 10 degrees between the cameras for the stereoscopic vision, and this is also the angle that changes here. And if I go back to the 3D mode, you will see that picture slightly changed, but we made really good experiences with this in the deeper cavities. So
Okay, Chris, it sounds like you know what you're talking about, judging from the question you asked.
I have a little idea. I just thought
Let's hear it. Let's hear it.
No. He answered it. All good. I'm going back on mute. Let the other questions come through.
Okay.
Thank you.
Okay.
Thanks.
Okay, Lars, next question, Lars.
Yeah, it comes from Mr. Radim Cambridge, and he has one of the first question of him is how does the surgery time shorten the operation process generally since using Roboticscope? And Mr. Cambridge, Radim, that's a question we are dealing every day with, and we are just evaluating with and making some studies and evaluations to get to know what time we can save. As I mentioned in the first sentence, we are a really young company, and we are out under these really crucial circumstances with the pandemic all over the world. And so we have done a lot of surgeries, but not so much that we can have a really good research on this question. How does it shorten the time by using it? But it will come. There are some studies in the background, and I think the first one we will see by end of this year, beginning of next year. So I hope this answers your question good enough.
Definitely. Thanks a lot.
Yeah.
Thank
okay.
you.
And the second question. So I think you are working or you have a signal in our company. As far as I know, some other companies like Synaptive or Olympus also have similar systems. And how do you compare with them? And it's really a good question. It's also a question which comes in tenders. If hospitals would like to buy this our Roboticscope, and it's really, really difficult to compare it to other systems. Every system has its unique, but we are more unique. Let me answer the question in this way, because with our system, it's really software based, as Natalie and Felix mentioned, and throughout the hands-free movements and the ergonomic positions, these are the main advantages of our system currently. Maybe we will detect more in the future with your help, but this is what we know now.
Okay, thanks a lot.
Hey, Lars, a quick question. The CEO got the idea initially, correct, for this technology? Lars, did you hear that? No? Can anybody hear it?
yes, we heard it. So basically, Markus Hütter, Michael Santek, and Gregor Boger are 3 founding fathers, and their last names spell together the name of the company, BHS, Burger, Hütte, and Santec. And especially Marcus and Mike have a lot of knowledge and experience in the field of the ENT surgeries, because they worked for another medical technology company here in Innsbruck, who's called Mire. And there they have been to a lot of surgeries and saw that just the visualization of the microscope has a lot of developing potential. And they had the idea to create something which follows your needs, which is just a device fitted for the surgeon and which follows your daily work as best as it's possible. And for example, those 3 to 4 hours surgeries, I'm sure some of you already experienced standing in an unlikely position for a lot of time. And these circumstances they wanted to abandon, and that's why they started in developing the Roboticscope. And yes, that was the idea born back in the days.
Okay, very good. The email address of the company is in the chat box. So you have more questions, Lars?
No, just one to Felix. Maybe Felix, you can show the position story.
Yeah.
Of a position, yeah. Maybe this would be interesting for the panel.
Okay.
We could just go through, for example, a workflow which you might come across in your neurosurgical operating room. For example, when you want to bring the X-ray in to make a X-ray picture, you need to have more space around the patient, and therefore you want to save the position that you are looking now. So I go again for this cat symbol, and there earlier I start on the upper left side. I start the position, and now I want to say, okay, I have to bring in the arrow. I can go to this pre-start position, which is called away position, and I go back to confirm, lift my eyepieces to see what the robot is doing, and then the robot is going into a so-called away position, so that you have more space to bring in the C error. And then when you say, okay, image completed, you go back to the pre-start position, and it moves with a precision of 0.02 millimeters back to the position which was stored. So highly precise. Exactly. So that was about the saving of positions. Are there any other questions regarding the functions?
No. Well, you know, I have a question. It's probably a pretty general one. Well, you mentioned a couple of times on the website the advantage of not having, I'm not a neurosurgeon, first of all, which is going to be obvious by this question. You keep mentioning the advantage of not having your hands in the operating field. Now, maybe a neurosurgeon can answer me that question. Why is that advantageous? Tell me why. It's better to not have your hands in the surgical field.
Maybe I should correct you. Hands are on the operational field, and that's the thing. And you can leave them there. You don't have to take them off.
Yeah, that's what I meant. Maybe the question was, yeah. I mean, it's better to leave your hands in the field, correct? Yeah. So, yeah. Why is that an advantage? So you don't have to reposition your hands when you get back, or what's the reasoning?
Yeah, first of all, the possible time saving. That's the thing that you could say, that you don't have to leave the tools on the table, adjust the microscope, and then go back to the procedure. That's one reason, but like I said before, we haven't. It's not official yet, but we are assuming that it's going to that direction. The second of all, it's the procedure, because you don't have to when you're not leaving the operational tools on the table, and you don't have to take your hands off, you never miss the look to the field. You always have it on your view, and you always see what's going on, and you don't have to go away from it. And that's like, you never lose the area, how to say it.
Yeah, you know, I know if you heard that question at a conference, you'd say to yourself, this guy isn't a neurosurgeon.
No, it's a good question, I think. No, it's a good question. And it's good that you brought it up, because that's one of the main advantages, that you can really keep operating. And like, we don't say that you should keep on operating when you're adjusting the microscope. Like, that's not how you should do it. But like, on the time when you are adjusting the microscope, you can, at the same time, you always have it on your view. You always know where you are, and you always know where you want to go next. So that's making it easier, we hope.
Very good, thank you. Okay, Lars, do you want to wrap up ours, or do you have any more things we want to do?
I think we are through with the demonstration of the robotic scopes, and thanks for your questions, and thanks for your time. And
one thing, Lars, I want to show, you're going to Karad, right? I want to show the audience about the Karad. Krishna, you're going to Krishna, right? Okay.
Later this year, if this will end, and
this is my turn to screen share. This is my turn to present.
Yeah, great. Yeah.
Okay, there we go. That's Krishna Institute of Medical Sciences in Karad, India, southern India. And here's this little tour. And you're going to bring the unit down there, hopefully, or May or June, correct?
Yeah, that's correct. We are just organizing it and negotiating it with Iberian. And yeah, the current planning is that we will be able to join Karad in, I think, end of May, beginning of June. This is the current status of this. And yeah, then it will become a training center for the robotic scope. And yeah, everybody is invited to join it, and also to join Innsbruck if you like to see more. And yeah, I've put our website address into the chat for all attendees. And yeah, we will be more than happy if you come back to us with questions, details anytime. And if you like to have it in your hospital or in your department, yeah, just write us and we will reply and make an appointment.
Can we meet your team, the rest of your team, Lars? Can we meet the rest of your team? Mike, we haven't met Mike formally, have we? Do you have other members of the team here? I'm sorry, maybe I just didn't.
It's just to introduce. It's Robert Kovac. It's our manager for the United States. Yeah, we have Felix, who has presented it as a clinical application manager. We have Paul without a video, which is our senior clinical application manager in Europe and for EMEA. And I think from the team is still there. It's Tom and Chris, and I see Alan. Yeah, we are now, I think, around about, Natalie, please correct me, 55 persons.
Yeah, including USA, we are like 55.
Including, yeah. Okay, and
Yeah, excellent. We look forward to following any developments at Neurosurgical TV, because with this platform, it's easier to reach the community with webcasting, and there's interaction. So anyways, we look forward to your next webcast, and thanks everybody for coming. Go ahead.
Sorry. Oh, he's out. Okay, I will join. I think there's one question, John.
Oh, okay. Go ahead. We have lots of time.
Yeah. So in case of technical defect, I am crushing. Or we expect the behaviors of the robot, I mean, is doing unexpected complications. Yes. So this is also a really good question. It is a software-based product, and as Felix said and Natalie, we have 4 components, and the main components is behind it's a software and a robot arm, and the robot arm is really an developing arm, which was not developed in the first row for medical devices. It is out of the automotive, and yeah, I think this is a really good robot arm, and he's really running well. I think, if I was coming to yeah, to technical defects or issues, we are able to help with our service department in a really cool way. Yeah, just phone us and we will help you. But currently we have not so many complications with the robot arm and the software. It runs really stable. Sorry, Natalie, I see you want to say something.
No, I'm not sure if I understood the question correctly. Is it was it about the software because it's software controlled, or how was the question again?
No, I think it was in general about a robotic, about the whole system.
Yeah. Okay. Yeah. One really important point anyway. It's even though it's software based, it's still surgeon controlled. So surgeon is all the time on control, and that's why it's like yeah, complications they don't happen because of the machine that much. So it's always the surgeon who is always in control of the system at the end.
Most important safety feature is the foot switch. As long as the foot switch is not pressed, there won't be any movement. So every time you're afraid of hitting something, or you're afraid of making an unpredicted movement, you go off the foot switch and it will immediately freeze. I can also demonstrate this. It's hard to do it to film the floor, but I'm standing on the foot switch now. And for example, if I want to orbit, and I go off the foot switch and it freezes. So then we have the proof that there's no unpredicted movement. Also, when I change the working distance, for example, back to 450, and I see, okay, maybe I might hit something, I go off the foot switch and the procedure stops. And when I go back onto the foot switch, it will ask me to continue the procedure or to abort it. And if I go to the left side, procedure will be completed. So now we have 450 millimeters of working distance again, as I explained earlier, and I can go back to work.
Yeah. And one thing that I still wanted to say was there was a question about differences about Orbi and Synaptive.
Correct. Yeah.
About the differences. Yeah, I would like to go back to that question again, because one very important difference that there is that you're not with Roboticscope, you're not you're not dependent about the screen, about the big screen. With Synaptive and with Orbi, you have to have the big screen in the operation, and you're operating with it. So with Roboticscope, you have actually the screens closer, please. You have the screens and the view here on the head-mounted display. So you see it on your eyes, and you can operate basically wherever you want to. So you can sit on the other side of the table if you want to, or you can choose any position. So you are not dependent on the screen positioning, and that's maybe one of the biggest differences when it comes to these systems. Yeah.
Okay, very good. Corrado, Corrado, are you there?
Yes, I'm here.
Yeah, how you doing?
Fine, thank you.
Yeah, I'd like you to meet the team behind this Roboticscope. Do you have any questions, Corrado? It became kind of late, I guess.
Okay, I can ask through microphone or through Q&A.
However you want.
Okay. Yeah, I will follow. I connected 10 minutes, 15 minutes ago, I connected.
Oh, okay.
Okay, so, okay.
Very good.
You missed the first part, but as I heard, it was recorded, so you can watch it later, or we also posted our email contact. So we are right now really looking forward to come to the neurosurgery departments and to go out and to work with you as the experts, as the neurosurgeons, and to make the Roboticscope a standard device in the operating room.
Okay, I'll send you the link, Corrado, of the
Okay,
video.
okay, but you know, your platform is a warranty. So if I lost the first part of the meeting, I can follow your platform as usual.
Okay,
In streaming recorded time. Just to check what is these tools. It's very interesting.
yes,
okay.
it is. Go ahead, Lars.
Maybe, yeah. So sorry, John, for interrupt you. Dr. Corrado, are you situated in Italy? Is it correct?
Yes, he's in Italy.
He is in Italy. Okay. Yeah. So it is not so far away from Austria, and we have a distribution partner in Italy. So if you connect to me or to our via our website, we can make it possible that you can have a demonstration live in your hospital. Oh.
Okay, I'm sure he'll look through it and determine if he wants to do that. Let's see, any more questions from the panel or comments? This is your chance. And we'll always be back and be doing more webcasts. Okay, very good. Any other business we need to do, Lars? Anything else?
I think I just want to say some closing words. Really thank you. We appreciate your time and the chance. And thanks to my team. Applause. It was a really cool presentation. Thank you, and thank you for your time. And yeah, see you later in our next webcast.
Okay, thank you. Hang around to network with the team. Okay, see you next time.
Thank
See you
you.
next time. Thank you.
Bye,
Bye-bye.
everyone.
Thank you. See you.
Bye.
Bye.